I'm Diana, and I'm Back
Girl. Back girl, back girl, back girl.
My mom actually started, she'd bring in a shirt. This was during my hospital visits for when my friends would show up to the hospital, they could sign the shirt, and then I would wear it during my rehab, my physical therapy, and I have 3 shirts now out of the 4 surgeries that I had, and they're kind of fun little keepsakes. Like, I like wearing them. And my friends have that chance to kind of give back while I'm healing. I feel like I get very close to the medical professionals that help me. Probably some would hope that I get less close to them. My physical therapists I work the closest with because I'm with them for months at a time, sometimes a year. So my last physical therapist, I had him keep all of my patient notes in a Hello Kitty notebook that I had. It's also where I kept track in my journal of all the exercises and stuff. So having, this poor grown man, like, writing in a Hello Kitty notebook with me and writing, like, little notes of encouragement was pretty cute. And I'd write notes of encouragement to myself, and I'd use, like, the ridiculous stickers from the Hello Kitty notebook. Staff and some of my colleagues, before I went in for my fusion, got me a giant box of dress up, which I brought to the hospital, and anyone who came to visit, including the nurses and the doctors. Like, I feel like I encourage people to visit me. Sometimes it's hard to visit patients, especially when you know they're in a difficult position, and I think that some of the medical folks enjoyed coming to my room because they knew that I'd have a positive attitude, and I also dress in hot and fluorescent color pajamas when I stay in the hospital. I mean, I'm talking fluorescent, like hot color pajamas. And that's to brighten my day as much as it's to brighten everybody else's day, because, the more you bring a brightness to your community and the people who are taking care of you, the easier it is, for everyone to kind of keep their positive
I also bought
thinking. Myself a cotton kimono, which I wear instead of the Johnny. Even when I go to regular doctor's offices, I like to keep my own clothes, and as long as I've washed it and the doctors feel comfortable, I always ask, I will put on the kimono, and I like it because it has big sleeves, so if they need to access my arms for IVs or taking blood, then that's the best choice. And for me, every time I have a friend who goes into the hospital, I try to give them a cotton kimono so that they feel more comfortable than wearing, like, the hospital gown. And one of the final things that has really helped me cope is having a fantastic network of family and friends. For me, I have a big family and a big base of friends, and for me, that's what works. Connecting with people is huge for me to keep myself positive and keep all of those around me positive. I'm obviously a big entertainer because I enjoy having people having a great time around me, and it lifts me up at the same time. And I have a great network of medical experts and medical folk who help and work with me on a daily basis so that I can continue to heal. All of this put together has helped keep me in good spirits and make me feel completely supported through this healing process and through dealing with the disease. And I find that having this network is probably one of the quintessential, most important parts about dealing with degenerative disc disease. And lastly, one of my favorite coping mechanisms is story. I feel like you get a lot of power from being able to tell your own story about your own struggles and your challenges. And working with degenerative disc disease and being able to craft my own story about my experiences has given me a lot of power. And I feel like storytelling on a wider spectrum has become my superpower. It's my belief that when something inside you or around you is weaker in your life, something else gets stronger, whether it's spiritually, emotionally, socially, physically. Something else gets stronger when something else inside you or your life is weaker. And it can be anything. It can be, some form of art that you've developed, or you challenge yourself through going through a race. Something inside you gets stronger. And for me, it was that power of storytelling. The power of my story has really helped endow me with a way of coping and being able to tell my story because of how many times I've had to tell it to the doctors, which is where it started. And then more and more folks want to know what the heck was going on with me at such a young age to have so many surgeries. And I agreed with them. So telling a story and finding that superpower, that secret strength that's coming from you dealing with something that's either chronic or huge or traumatic, something inside you will get stronger. And that's your superpower. And that's it. So for me, coping is about how you frame, how you look at things, having a sense of humor, being bright whenever possible through dress up, through unbelievably inappropriate underwear, to keeping a Hello Kitty notebook. Keeping positive is huge. Having a supportive network is awesome. And then being able to create your own story, or finding your own superpower, or both, to help you get through this and cope with living with a chronic disease. Those are my coping tips. That's what I've developed. Oh, and naming your brace, possibly your spine. Also fantastic. Obviously, some of my coping mechanisms point towards the fact that I've been able to cope with this in a positive way. Maybe not the most sane way, but it's worked for me. And it'll work for you. You'll find your own way. But those are my tips. I'm Batgirl, and I'll see you later. Oh, and the next video will be about the fusion. I'm also looking for more people who have dealt with degenerative disc disease from a very young age. I know there are more people like me out there, and I'm trying to kind of start a community. I'm happy to talk to folks who have degenerative disc disease, 30s and plus, but I'm really looking for the younger folks, because when you deal with degenerative disc disease from such a young age, it obviously impacts your development in different ways, and I want to see how everybody else is coping, and maybe share resources as well. Obviously, this video series is also another way that I've learned how to cope through my fusion healing process, and I'll talk more about that next time. See you later.